Do you have pain in the same location that isn't getting better with stretching or strengthening? Does your pain travel from one spot on your body to another? Maybe from the side of the neck down to the shoulder, or maybe the base of your neck down to your upper back, or maybe your glute down to the back of your hamstring. Does the pain fluctuate up and down based on your posture or your position or your activity level? If this sounds like you likely have what's called a nerve entrapment. A nerve entrapment is what happens when a nerve becomes stuck to another tissue, usually another muscle, tendon, or ligament. Due to postural compensations, injury, or overuse, one area of our body can become concentrically oriented, which is just a fancy way of saying flexed all the time or tight all the time. This will lead to a lack of blood flow, excess collagen buildup around the nerve, which will lead to the nerve becoming stuck or adhered to a surrounding tissue like a muscle, nerve, or tendon. These are the most common places we find nerve entrapments in our office. So the accessory nerve is one of the most common nerves that we see that gets entrapped in the office. The accessory nerve runs from the base of the skull down through the shoulder blade. And when that nerve is stuck, you'll feel burning or achiness or tightness in and around the shoulder blade and even up the neck sometimes. Here we are treating the accessory nerve. We're using our hands to create tension where the nerve is stuck to the muscle here, in this case the rhomboid. By creating enough tension, we can free up the nerve from the muscle so it can glide through that space more easily. Another extremely common nerve that we find that becomes entrapped is the sciatic nerve. When this nerve gets stuck, it often gets stuck in the back of the hip. And when this nerve is stuck, you'll feel tension or pulling down the hamstring or a deep achy sensation in the back of the hip. There's a few ways we treat this nerve. This is one of the ways that we use radial shockwave. The shock waves are sending sound waves deep into the tissue, and I'm bowing the nerve off of the muscle to free up the nerve so it can glide through that space. And this is the sciatic nerve as well. I'm just treating it lower where it's stuck to one of the groin muscles, the adductor magnus. And again, I'm creating tension along the nerve to where it's stuck to the muscle to free up the nerve so that it can glide. And then lastly, the cluneal nerves. These are three nerves that run over each hip crest. And when these are stuck, patients will often report achiness or tightness in and around their belt line of their low back. Because the cluneal nerves are so shallow, we can use this soft tissue tool to treat them effectively. Here we are scraping along the nerve right as it travels over the hip crest to free that space up. If you've watched our treatment videos for a while, this is what you're often seeing us treat. We're using our hands or the radial shockwave machine or sometimes a soft tissue tool to break up the buildup collagen fibers or the adhesion around the nerve to free that nerve up so that it can move and glide smoothly through that space. It doesn't end with just treating the area. Remember that concentric activity that we talked about earlier, that really tight area? That existed oftentimes before the nerve became entrapped in the first place. So this is where our rehab exercise drills come in to help teach the body to let that space relax and to open up so that the nerve doesn't become stuck later on. This has a lot to do with why patients will feel better after coming to our office. Because oftentimes these nerve entrapments haven't been addressed with what they were doing previously. Whether it was stretching or strengthening or other providers they were seeing, oftentimes these go underdiagnosed or undertreated. So if this sounds like something you've been dealing with for a while, and maybe you've seen other providers and it hasn't gotten better, give our office a call, shoot us a DM on Instagram or shoot us a message on Facebook. We'd love to see if we can help you. We can't stress enough how many people we see a day or a week that have these similar issues that have gone undiagnosed or untreated by other providers. So if you're suffering and if you're feeling like this video is resonating with you, don't hesitate to reach out. We'd love to help.